Hi folks, this is a new YouTube channel. I am exactly 4 weeks post C-spine surgery. It was pretty extensive. I had 5 levels of laminectomy from C3 to C7 and 2 levels of laminotomy, C2 and T1. I've been fused from C2 to T1, and I have hardware from C2 to T1. I've joked that I have enough titanium in the back of my neck to build an F-22. Why am I making this video? I've learned quite a lot about the condition that I had or have in my C-spine from watching other YouTube videos. And at this point, I would like to give a shout out to W.J. Chen and especially to One Stop Guy, who both underwent similar surgical procedures, and I found both of their videos helpful to me. But I felt like my pre-surgery condition was different enough that perhaps some other people would be helped by me making and posting this video. And I also came to realize in watching some of these other videos that I had a very unusual circumstance. I probably had the most extensive C-spine surgery that I've encountered by searching in YouTube. Again, covering 7 levels, but I was asymptomatic. So I had none of those signs and symptoms which would drive a person to a neurosurgeon for correction. I had no numbness in my hands. I had no tingling sensation in my arms or legs. I had no difficulty in walking or unsteady gait. None of those things. So why then did I go see a neurologist and ultimately a neurosurgeon? Well, it started 35 years ago. I am retired now, but I worked my entire adult life either with horses all the time or using horses for my primary job. Started out a long time ago as a seasonal with the U.S. Forest Service in Utah, and I was a wilderness ranger, and my mentor taught me to shoe horses and pack, and I started going down to Arizona in the winter months and wrangling dudes at a Arizona guest ranch, which is, by the way, where I met my wife. And I continued to do that. I did cowboy work. I ultimately went to college and graduated with a degree in rangeland management and worked for the U.S. Forest Service. And so I used horses all the time with the Forest Service. Oh, by the way, also, my wife and I, right after we were married, bred racehorses in the San Ynez Valley of California. So all that as a lead-in to the fact that I bucked off a horse that I owned about 35 years ago very hard. He turned me upside down and I hit on hard pan right up here at the top back of my head. And I thought maybe I escaped serious injury, but I did not. The next morning I couldn't, my head was essentially locked down like this. I couldn't raise it or turn it either side. And x-rays were negative for a broken neck, and that was the extent of the diagnostics at that time in those years. This was, by the way, a small town in Arizona where this occurred. And what apparently happened was that I tore ligaments in my neck and impacted my C-spine, and as it turns out later, caused the medical condition known as anterolisthesis at C2-3, where those two vertebrae move on each other. As a result of that horse wreck, my spine became my weak point. If I was under stress, if I overworked, throughout my adult life, my neck was a problem area for me. Although I really led a remarkably unrestricted life. I trained in martial arts. As I said, I worked for the Forest Service. I packed horses and mules. I rode for hours. I did weight training. In all those things, for the most part, my neck wasn't really an issue. At different times, like I said, it would act up and I'd take Advil for a few days and it'd quiet down and I'd go back to work again. But I have some family history that gave me concern. Let me check my notes. I don't want to miss something here. So, in the last, I'll say 7 or 8 years, perhaps that long, I started to notice my neck condition getting worse. I've lost a bunch of upper body strength, and that's mostly because as I aged, it was more and more difficult for me to lift heavy weights without my neck really acting up. And so I avoided it. And I used to do, like I said, weight training, push-ups, sit-ups, all those things. I got to the point where I couldn't do any of that anymore. And my periods of neck soreness got closer and closer together. I was working for moving around like this. I was working up on the Bridger Teton in northwest Wyoming. And I was district ranger of a spectacularly beautiful district, the northernmost district on the Bridger Teton, just below Yellowstone, just to the east of Grand Teton National Park. And my neck was bothering me, and I saw an orthopedic spine specialist. And she obviously didn't want to operate on me. So she ordered x-rays, and as I recall, x-rays alone. And she's the one who pointed out that I had this anterolisthesis, this movement between C2 and 3. And she ordered 2 sets of 2 injections into the right side lateral facets. I guess all facets are lateral, whether they're right or left side. They sit on the sides of your vertebrae. But anyway, put 4 injections between C2 and 3 to quiet things down. And I guess it helped a bit. It was a cocktail with a corticosteroid and an analgesic of some sort to help it feel better. But she did not recommend that I see a neurosurgeon, pursue anything more serious than the injections, and in fact said, well, these injections could be repeated from time to time. It was the anesthesiologist who actually did the injections who said to me, you might want to visit with a surgeon, a neurosurgeon, about your neck. So anyway, when it got to bothering me several years later, and I'm really talking the end of 2019, November, December, I went and saw a neurologist, and she ordered more x-rays and an MRI. And my wife and I are sitting in her office, and she's reviewing these images. And I distinctly recall that she said, when I look at these images, I can't believe that you're the person that these images were taken from. In other words, as I stated earlier, I'm asymptomatic at this time. I don't have the numbness, difficulty walking, any of that stuff. But my C-spine is a mess. And as she's looking down through the MRIs, an MRI, they can take slices down through, or maybe I'm thinking of a CT scan. I think in the MRI, she was able to look down through the different levels of my cervical spine, and there were multiple levels, at least 3, from 3 to 6, where she could see no CSF at all. CSF, cervical spinal fluid. That's your brain and your spine and your spinal cord are protected by dura, a rubbery covering. And underneath that covering, between your brain and your spinal cord, is cerebrospinal fluid. It does a couple of different things, but its main function is to kind of serve as a cushion protection for your brain and spine. Well, my spinal canal was so narrow that she could see no CSF down through from 3 to 6. If you've seen your own MRIs, I assume if you're watching this, it's because you've got C-spine problems and are either have had surgery or are facing surgery. If you've seen your own MRI, CT scan, then you know that CSF shows up as bright white surrounding the dark spinal cord. And there were places where there was no room for CSF. My spinal canal was so narrow that it was completely shutting off the CSF fluid. Some important family history that also led to me going to see this surgeon. My dad had congenital stenosis. Again, these are important medical terms. If you are facing spinal surgery, learn as much as you can about the spine, about your specific condition, and learn these medical terms. It's important when you're talking to these doctors to know the terms that they're using, and be able to communicate with them about what they're seeing and what you're experiencing. Stenosis simply means narrowing of the spinal canal. I'm not accomplished. Like I said, this is my first video. I'm not accomplished at splicing in pictures and stuff like that. I promise that should I make another one of these, and I intend to, that I'll learn how to do some of that stuff. But if you look at a cervical vertebrae, the front of it is the vertebral body. That's a roughly cylindrical shape piece of bone. Your spinal cord runs along the back of that vertebral body, and it's protected and covered by the vertebral arch. The top of the arch is the spinous process. That's the bony projections that you can feel if you run your hand down, or at least I used to be able to feel on my C-spine. The most prominent one, as I recall, is C5. That one sticks out quite a ways. I think you can probably feel C7 pretty well too. The spinous process is held in place by the laminae. The laminae are flat bones on either side of the spinous process that form an arch. So you've got the vertebral body in the front, you've got the laminae and the spinous process that form the arch that the spinal cord runs down through. Probably should have got some of the, since I got deep into this, the foramen, or the areas where it exits, where the nerve roots exit the spine at different places. And those facets are the joints that form the foramen. Somebody's going to correct me and say you're way out of your league here, T, but that's the way I'm remembering it right now. At any rate, my dad presented like a stroke patient in the last several years of his life. He did not seek medical treatment, and he started by dropping glasses out of his hands, and before it was all over, he was paralyzed on the right side of his body and required my mom for a long time to take care of him until she could no longer do so. So I had this injury. I had this injury. I had issues with my neck my entire adult life. And I had this important piece of family history that drove me to have it further looked at. The neurologist sent me to a neurosurgeon, and I ended up seeing a second neurosurgeon. Here again, do due diligence in researching your condition. The first surgeon had a pretty conservative approach. She wanted to do laminectomy and fusion on C3 to C6. I knew that I had spondylolisthesis at C2-3, and everything I read said when you do laminectomy and fusion, it puts greater strain on the vertebral joints above and below the site of the surgery and fusion. And the more I thought about it, it just didn't make sense to me to not touch C2 when I already knew I had movement between 2 and 3. And I'm sorry I'm moving around so much. I'm frankly a little bit uncomfortable. I do have one of those C-spine collars, but I don't really want to wear it while I'm talking to you. Again, let me check my notes. I'm pretty well through this. So I saw a second neurosurgeon. His suggestion was much more radical, and he wanted to fuse all the way down to T2. Saw some, again, anterolesthesis between T1 and 2, and wanted to go all the way down to there from C2. But the more I got to thinking about the condition that I am dealing with and how serious the surgery I was facing was, the more I thought, I think I should try to find the best surgeon that I can. And so I began to cast a wider net. And I contacted the Mayo Clinic, and they turned me down. Just saying something like, we get a lot of requests from people who would like to come to the Mayo, and we can't take care of everybody. I ended up going down to Phoenix, and I haven't decided yet if I want to get deep into where I ultimately went, but I am happy with the decision that I made. And I had, of course, all this time that we're talking about is in the midst of this COVID-19 pandemic. So I visited with my surgeon by video conference, and I was quite satisfied with the respect that he showed my wife and I, the plan that he put forth, viewing the images. By this time, I had a complete suite of diagnostic images, MRI, X-rays, and CT scan. And I thought what he proposed made sense. And so that's where we went. We went down to Phoenix. Spent 2 days in the hospital. Took our time driving back here, where I'm in Wyoming. And recovery's going okay. I'm no longer, the only medication that I'm taking now at 4 weeks is Tylenol. That's been true for at least a week. The last drug that I took in addition to Tylenol was a muscle relaxer. They were concerned that because of the great deal of disturbance to the muscles in your neck when they retract, to work on your C-spine, there was a risk of muscle spasms, which can be apparently quite painful. The medical secretary for the surgeon described it as a knife blade between your shoulder blades. So I left the hospital with some oxycodone and no refill script, and I never did refill. I had enough to last 2 weeks post-surgery if I did not use very many of them, and I kind of weaned myself down to just taking those at night before bed to help me sleep better. By the second week, those were gone, and I did not try to get any more. The muscle relaxer methocarbamol, as I recall, I also tapered those off for, I guess, about almost 3 weeks, and I never felt those. I could not tell whether I had taken the methocarbamol or not, but I didn't experience the muscle spasms, so I guess they worked. Now I'm taking 1,000 milligrams of Tylenol as needed. I think yesterday I only took it once, and I took some Tylenol just before this video, and I'm doing okay. My neck is stiff. I feel like a pulling sensation. There's a stinging pain with some movements, especially at night. I'm a rather restless sleeper. So when I toss and turn, boy, there can be some movements that hurt. But otherwise, doing okay. I should show you my incision. I'll swing around here and put my back to the camera for a moment so you can see it. The incision runs from the base of my skull to the top of my thoracic spine. My surgeon did not use staples, for which I'm grateful. There are some sutures sub-Q, but the surface incision was sealed with, I believe the trade name is Dermabond, a surgical glue, and it makes for a kind of a nice, clean-looking incision. So here's my incision. I assume you can see that all right. With that, I will close. I've got some, it says here to look at my diary notes for the last 4 weeks, but I also see that I'm over 25 minutes and I don't want this to run too long. So I will close this video out. I have another video conference with my surgeon in 2 weeks. That'll be my 6-week period. He'll take a look at this incision and we'll talk about what my recovery looks like from that point on. And my intention is to make another video right after that conference. Maybe I'll get into those notes at that point. I hope that if you are facing C-spine surgery that you got something out of this. If not, I'm sorry. I'll talk to you soon. Bye.